People are getting older because of the advances in medicine. And people talked about the concept of healthy aging. How long do you age and remain healthy? Most of healthcare intervention is usually hospital-based, but conferences like this usually bring in other areas of intervention, usually much more community interventions, public health issues, community empowerment, which is often lacking in our Malaysian context. Policymakers want to deal with healthy aging. Policymakers need to look at wellness. But if you talk to people that are not so well, who are ill, they're worried about the future. They're worried that people with dialysis, people with heart disease, people with cancer, what's going to happen to them?
Our committee is a very unique committee, even though we say it's organized by Palliative Care Sarawak. But this committee composition of the committee is actually from the various NGOs who are actually very active in palliative care. We're actually working together as one team. So indirectly, I think even through the organizing of this conference, our relationship is further strengthened. We would like to see more community engagement, community participation. In fact, we hope that palliative care in one day will be community-led.
Conferences are not just about learnings, but it's the connections we make, the networking that occurs, that connectedness of the human experience. And when we come to a conference, we are so inspired. And so yes, in the moment we are inspired, and that inspiration needs to carry us forward when we take it back to our countries, back to our teams, and we need to implement some of these aspects of learnings, teachings, evidence-based practice, awareness, social aspects. That is when we can actually take it back.
I've attended these conferences, the APHC, they're my favorite conferences because I always learn so much. And what I learn so much from is about how everybody has their own wonderful way and unique way of caring for people, but also there's a commonality in it, where it's an honouring of and alleviating of suffering on all levels.
I think this conference has really been a very important platform. Firstly, we are able to launch the Atlas of Palliative Care for Asia Pacific. This is a really important work that has been done by Professor Carlos Centeno and his team to help us to derive data that will help to further inform, that will help to further advocate for palliative care, improvement and expansion in Asia Pacific. This conference has been one of the catalysts and a platform that enabled the launch of the Sarawak State Task Force Committee. It marks a new era for palliative care development in Sarawak with the Task Force Committee that will help to bring together all the different stakeholders, be it in the hospital, in the community, or in volunteers, NGO, hospices, to come together to find better ways, strategies and policies to provide palliative care that will really reach the patients and the community where it's much needed. This really helps to strengthen the vision and spearhead this movement and strategy.
I really like the fact that we're currently now thinking outside the box, not just looking into what healthcare and clinicians can do, but looking into upstreaming palliative care even further and looking into it from a broader spectrum of public health setting as well.
You are capturing maybe 1,300 people here. You've potentially got tens of thousands of health workers in the state who could benefit from it. How do we get the key messages here out there so that they benefit from it? It's not a static conference, it is a living conference, and it has a legacy.